So there's lots of different mobilizations of the AC joint itself. And you'll see that this chart here, it's like, okay, if there's an early loss of flexion, then you want to, take the acromial part and push it anterior, or you may take the acromion and hit it anterior. And if there's an early loss of extension, you can take the clavicle and move the clavicle anterior on a fixed acromion. I find a lot of times you can go through those and find different glides as we have just done, but a lot of times we can just get one finger on the clavicular portion and the other finger on the acromial portion, and then I like to bring my hand down to kind of stabilize because you're doing an inferior force. And you can say, okay, well, if I want to bring the anterior, the clavicle anterior, I can hit it anterior that way. If I want to bring the AC anterior, I can hit it anterior that way. Or I can just get into this position here and I can hit both and do a distraction. So then you can get here and you can just do a distraction that way. And then what are we going to do? We'll have to come here and see if we reassess our motion into that elevation, protraction, and then retraction and depression, and see if we improved our motion. And then we can get into this position here and see with elevation through flexion if we're improving the mobility there, and then sit the patient up and do our neuromuscular re-ed, see if it opens a window through testing and retesting some of the tests, whether they're AC joint specific or functional range of motion tests.